Meet Sid. Sid doesn't feel so good. He's got to see a doctor. What else is there to know, right? Well, thankfully, Sid's employer-sponsored health plan includes access to AIM for healthcare concierge services, just like yours. Because if Sid wants to avoid a gigantic bill, there is a lot more to know. Sid has access to a dedicated team of nurses and doctors who can help him to make sure that he gets the right care, at the right time, in the right place, and for the right price. All Sid has to do is call the toll-free phone number listed on the back of his health plan ID card. For medical attention that's not an emergency, Sid should always call his AIM Healthcare Concierge. Here's why. Sure, Sid's doctor may be able to make perfectly good recommendations, but he's not familiar with Sid's medical plan, so Sid could get stuck with a bigger bill than if he had talked with AIM. Sure, Sid's doctor may be able to complete the pre-certification process required by the health plan, but it's likely his staff will wait until the very last minute, and if they run into a problem or completely forget to do it, Sid could be faced with the decision to either delay his care or risk paying for it out of his own pocket. As soon as Sid knows that he is going to need something more serious than a simple doctor's office visit, he should call AIM. If Sid doesn't call AIM, he may miss out on all the wonderful information, resources, support, and guidance that the nurses of AIM could provide to him. These are things that would help him to ask his care providers the right questions, help him know his treatment options, help him understand what things he can do to help him get better faster, and help him to stay informed about the financial side of his healthcare. If Sid does experience a health emergency, he should call AIM as soon as possible. This is not a substitute for 911, but if Sid does have to call 911, once he is stabilized, he should have someone call AIM. The Healthcare Concierge team at AIM is here to help Sid and you navigate both the health and insurance systems. By the way, just like Sid, you may receive a phone call from the nurses at AIM. If you do, please be like Sid and talk with them. Besides waiting on you to call, AIM goes through the medical bills submitted to the health plan and identifies people who may have forgotten to call us, and then we outreach to those patients. If AIM is calling you, please make sure you respond. So no, Sid doesn't have a choice about needing to see a doctor, but he does have a choice about how much time and money he ends up having to spend trying to get better. So save the AIM phone number in your phone, and if you're ever sick, give us a call and let us help you make the best possible choices.